So we will explain the glossocomal coma scale. Okay, glossocoma scale. So first of all, you have to remember that glossocomal scale. It is a scale. It is a scale. Okay, this is made by a scientist. Okay, and that scientist for the comal state of the normal behavior and the normal function of the body. So it have three things in this is occur. Okay, one is the eye, another is the verbal response, another is the motor response. So the glossocomal scale is based on the three things. One is on the eye, okay, another is the verbal response. So on the eye, another is the on the verbal response, and the another is on the motor response. So these three things, these three organ make the glossocomal scale. So okay, so another thing is you have to remember that glossocomal scale have total number of the glossocomal scale is 15. Okay, if a body have completely well functioning, and their body and their eye and everything is correct, okay, everything is functioning well, so it's got 15 number on the glossocomal scale. And it is between the glossocomal scale is between 15 to 3. It's never be 2 1. For example, if you count, I got in the glossocomal scale I got 4 number, okay, and the verbal response got 5 number, and the motor response got 6 number. So if you add this 4 5 6, this all these by adding 4 plus 5 plus 6, if you add this you got 15. So it's mean that if somebody have this 15 number on the glossocomal scale, they have well perform every function well. Okay, now so first of all we will tell about the eye opening, the verbal response, and the motor response. So if somebody comes to the emergency, how you can do, how you deal that. Okay, so first of all you have to do eye test. Eye, okay, eye, verbal, and motor. In eye, if they are spontaneously their eye is open, so it got 4 number, so you have to got 4 number. Another is the verbal response. If they have oriented to time person, for example, if you ask from them the time, the name from the person, and the place that where is now he is present, and the time that which time he is at which time now, what is the time now. So if they respond to these all things, so it got 5 number, they will respond to what you say. Okay, another thing is if you motor, you have to check the motor response. If he obey all the command, for example, you say to him that open your eye, grasp your rest, etc. Okay, and open hand movement, if you say any command to him and he obey your command, so it got 6 number. So now if you 4 5 6 you add this, it got 15 number. So he is very well. Now another thing is you have to again in eye opening, you have to, their eye is not opening spontaneously, it open to speech. For example, you ask from them to open your eye, or you drop something and he open their eye to speech, so it got 3 number. If you touch, for example, this is his nail, if you apply pressure on their nail and to the pen, so if to the pen they open their eye, so it got 2 numbers. Okay, if he have no response to the pen, to the speech, anything, so it got 1 number. Okay, never got 0. So another is the verbal response. In verbal response it have got 5 number. If they have oriented time, person, place, everything they is okay, so it got 5 number. If he is confused, for example, if you ask something but he replied sentence in the praises, okay, not complete sentence, you can't understand the complete meaning of their sentence, so he is confused, so you will give them a 4 number. Okay, if he just like saying the words, only words, so it got 3 number. But if he only sound, if he only says sounds, so it got 2 number. Okay, if he have no response, so it got 1 number. Okay, now come to the motor response. In motor response you have to ask from, if they follow your commands, so it is the got 6 number. If he move to the localized pain, for example, you painfully touch something, painfully touch their trapezius muscle, etc., and they move their hand, flex their flex their hand, okay, and that flexion, if they flex their hand, so it move to the localized pen, so this is got 5 number. Another thing is flex to withdraw from pen, move to localized pen. If you touch some area and they move their hand to that area. Another is flex to withdraw from pain. For example, if you touch the trapezius muscle so strong, okay, and they just flex their, for example, this is their hand, this is their hand, and they flex their hand, okay, just like withdraw from the pain, flex, only flexion occur, okay. So this is from the pen, so this is got for 4 number. An abnormal function, for example, this is the body, and what he do, he just, this is their hand, okay, they move their hand like this, okay, on their chest, and then move to the localized area on their chest, slowly. So this is the abnormal flexion. Another is the extension. If this is their hand, and they extend their hand like this, okay, to the posterior side, so this is the abnormal extension, it got 2 number. If he have got no response, so nothing will happen. So you have to remember these all things, okay. Now just revise everything. Glossocomal scale is based on the eye, verbal movement, and the motor movement. I, in the glossocomal scale, I have got total number 4. If the eye movement, if eye is very well if eye function is okay, okay, it got 4 number. If verbal movement is, if verbal everything speech is well accurate, it got 5 number. If motor response is well and they follow your command, they got 6 number. So it is going to 15. So just like this, if eye movement got 2 number, and it got 3 number, and it got uh, 5 number, so now this is the at this is got 10, okay. So you have, now for example, in mild condition, this is the in the glossocomal scale, you can see here. Now in the eye opening, if you count all the numbers, for example, if the glossocomal scale give you 13 to 15, it is mid. If it give you 9 to 12, it is the 12 to 9, okay, 9 to 12, it is moderate condition. But if it got to 3 to 8, you have to remember 3 to 8 numbers in the glossocomal scale, it is severe condition, okay. Now so you have to remember this thing, okay. Thanks for watching.